Two children in Hamilton, Ontario have died following surgeries at McMaster Children's Hospital. Both underwent tonsil and adenoid procedures. And the reason that the hospital has pressed pause, the reason the hospital has pressed pause on doing any more surgeries. Sarah Galashan is following this developing story. She joins us now. So Sarah, what details do we have so far about these cases?
Travis, what we know is that in one case, the child died a day after having this surgery performed. In another case, there was a 9-day window between the surgery and the death of the child. One of these deaths, we don't know which, but one happened in May, the other happening this month in June. There was a press release that McMaster Children's Hospital put out today confirming these deaths, saying that there's no apparent connection between the two, and out of an abundance of caution, they say, they are pressing pause on performing any more of these kinds of surgeries on patients who are under the age of 18. They are offering condolences to the families, and they are saying that questions are welcome from any patients or any families of patients who have underwent a tonsil surgery at that hospital in the last little while. As well, they are reaching out to any families with patients who are scheduled to have these surgeries performed because, as I say, there's a pause on this now. Now, the exception being that if there were an emergency pediatric tonsil surgery that needed to be performed, that still would happen as well. Adult such surgeries, they will still be performed, but the pause on the tonsil surgeries at the Children's Hospital, McMaster Children's Hospital, is going to be in place while an external subject matter experts are reviewing the pediatric program there. Travis?
Okay, Sarah, thanks for this. That's the CBC Sarah Galashan at the Breaking News Desk. Well, this story, as you would imagine, might have parents concerned, especially if their child has a procedure coming up. Let's dig a little deeper into this. Dr. Sam Daniel is the Chief of Surgery at Montreal Children's Hospital, and he joins us tonight from that city. Thank you, Doctor, for being here. How common are these surgeries in children?
Thank you, and for sure, it's very hard when there are tragic events like that, and they can be very stressful. So my heart goes out to the families and to the treating teams, which must find it really hard. These are very common surgeries. They're and one of the oldest surgeries practice has been practiced for many years, and extremely common in children. In particular. So in Ontario, for example, there are approximately 14,000 of these surgeries per year. In Quebec, in about roughly the same numbers.
Okay, so, you know, these cases, as you say, they involve tonsil and adenoid surgeries. Can you walk us through what these procedures entail and how complicated they are?
Absolutely. So the procedures are not complex or complicated. However, any surgery carries risks. So what it entails, let's start with tonsillectomy. What it is removing the tonsil tissue. What is this? This is what we call lymphoid tissues in the back of the throat on each side. You have a round structure and these are the tonsils. That's what gets infected, and when you have a sore throat, oftentimes these can be infected. In the past, the most common reason to remove these was recurrent infections. I would say today and for the past decade, the most common reason is related to obstruction or blockage of breathing. So children that have what we call obstructive sleep apnea, meaning they stop breathing at night, and this can be dangerous, and severe conditions can lead to cardiac and pulmonary issues. And these children require urgent removal of these tonsils when it's something called sleep disorder breathing, that is, the tonsils are large. There is no blockage of the breathing that is severe. However, the sleep is not restful, so the children are tired. They have school performance issue, behavior problems. That's another indication. In other cases, when children have huge tonsils that are interfering with eating, what we call dysphagia. That's another indication. So a number of indications. I would assure families that these are extremely common surgeries. It is rare that it leads to tragic events. It's less than about 1 in 20,000. For sure, this has to be taken seriously, and when a child undergoes these surgeries, there are indications to go along that pathway. For the other surgery, that is removal of the adenoids, or called adenoidectomy. So these are lymphoid tissues in the back of the nose. And what children experience is mouth breathing as the nose is blocked in severe cases, or recurrent sinus infections. And there are other less common indications.
So as I said, I know that you cannot discuss the specific cases, but you did say that death is rare, 1 in 20,000. But for parents watching who might be concerned because they have a child's surgery coming up, what would you tell them right now?
I would tell them, not to be scared and to have the courage to ask questions. I think it's important that we understand the indications of the surgery, and I would comfort them that these are extremely rare. What's important is really to discuss the surgery journey, because there are a number. So how it happens is for any surgery that involves removing the tonsils or the adenoids, it's done under general anesthesia. So that's something to discuss. Each child is different, so some children can be very healthy, other children can have other health issues that warrant some precautions, and these children undergo preoperative examination and discussion with the treating team. So if there are health concerns or pre-existing health issues, obviously this needs to be discussed. For example, one condition, if in the family there is a history of bleeding disorder that is known, then it's important to share that. I would say that the most common complication is pain after surgery, and that is something also important to discuss in terms of pain medication. The most feared complication is bleeding, and that can happen in the first 24 hours or up to 2 to 3 weeks after, as there are scabs sometimes that slough or a vessel opens. It's rare that it happens after a month. So
Right.
if you're planning to travel after tonsillectomy, perhaps to make sure this is discussed with the treating physician.
Some good advice there. Doctor, appreciate you being here tonight with your expertise on this. That is Dr. Sam Daniel, who is the Chief of Surgery at Montreal's Children's Hospital.